No sooner do we allow people to relax and put a drink in their hands that we ask them to all shut up for a very important event. So really, I suppose, to explain what things are all about this evening, the HRB Impact Award was something that we designed and developed last year, and we ran as a call. And basically, it's an award designed to recognise a researcher or a health practitioner working in research who basically over the course of their career has delivered an outstanding contribution to research with significant impact on people's health or on health policy or health practice. So that's really what we were all about. That's what we were trying to achieve. Tonight we're going to announce the award winner and to celebrate the achievements of an individual who happens to be in the room, who's really put their research into action in a way that's led to outstanding changes in people's health and patient care. So when we put the call out, we really didn't know what to expect and what we were going to get. And really it was amazing. We had a sense in our minds that there were amazingly talented people out there. Amazingly talented people who've drawn down HRB funding over the years. And we weren't disappointed when we got the applications, the nominations in. We had some remarkable nominations, and when we got the opportunity to read through all of them, and there were some awe-inspiring achievements in those nominations. And the international peer review panel who were brought in to review those nominations really had a tough job, and they said that any one of them could have actually won the award, but they had to choose one. So while they had a tough job selecting, they really, I suppose, were able to focus in on numerous aspects of the individual who won and their attributes. They spoke about the impressive knowledge transfer skills of him or her. The integrated approach to public and patient involvement, and the incredibly strong leadership demonstrated. So at this point I'm going to pause. I'm going to ask the person who nominated this individual, Professor Anne-Marie Brady from Trinity College, who's the nominator, to say a few words and to endeavour to do her very best not to reveal the name of the person quite yet. So, Anne-Marie.
Thank you very much. So this is going to be this is your life moment, and it's going to be a great challenge for me for the gender neutrality that I'm supposed to be using. But I am very pleased to be invited to contribute to this event this evening as the head of the School of Nursing and Midwifery at Trinity College Dublin, and also to be the nominator of this very, very important recipient of the first HRB Impact Award. And I thank the Health Research Board for that opportunity. The success of the TCD School of Nursing and Midwifery has been shaped by the activity of the successful researchers we have, who have a sincere interest in undertaking research that has a meaningful impact on the lives and health of people. As a school, our success in research has in no small way been impacted by the Health Research Board, as many of our staff have had their research careers enabled through the HRB funding and the professional development opportunity it has provided over the years. When the opportunity arose last summer to nominate a researcher and indeed a health professional from among the Trinity research community for the first HRB Impact Award, I was in the fortunate position as head to be able to look to the 4 distinct research pillars within our school: maternal child health, mental health, integration and innovation in healthcare, and indeed ageing and intellectual disability. All of these pillars have benefited from HRB funding over the years. The award stipulates that the research impact should have an identifiable impact, benefit, or positive influence on society, public policy, and quality of life. The desire of this nominee for impact from the research is well known and has been shaped by their professional background as a registered nurse in intellectual disability. Over the years, he or she has provided a substantial leadership role in the field, advancing a significant research agenda, while also providing invaluable guidance and mentorship to me and many other researchers. She has always appreciated the mentors. He has had the caring tradition for which he or she was educated, but from the start was never going to be restricted by what had gone before. There are many examples of the can-do attitude of this individual, but they were showing this capacity for challenging expectations and forging new ground at an early stage in their career. Indeed, as this individual took upon their job as a manager in a community care service, they were in their first supervisory position. And bypassing the usual procurement rules within the health services, he or she went into the town to the local furniture store and ordered furniture for the home that she was managing, the type of furniture she would have wanted, or he would have wanted in their own home. Others said it was unsuitable, it would never hold up, it was outside the rules. But it did, and in a small way, a home emerged for the individuals who lived in that community home. And indeed, this individual managed to hold on to their job as well. And this was to be a hallmark of this person's approach to care and research on people with intellectual disabilities. One of the distinguishing features of this individual, and perhaps why they are uniquely inspirational to many women in research, is that they think we should have it all: family, life, career, home, and friends. So the early career of this individual was about job sharing and trying new things. Going from a recreation therapist, he also tried general nursing, but kept going back to school and eventually found their way into research, and in particular into research on people with intellectual disabilities. There are many firsts associated with this person. The first PhD graduate from the School of Nursing and Midwifery at TCD, the first registered nurse in intellectual disability in Ireland with a PhD in nursing, one of the first awardees of the first ever Health Research Board Clinical Research Nursing Fellowship in 1999. This person has expanded the portfolio of ageing and intellectual disability research in Ireland and abroad, while also demonstrating unparalleled leadership as a woman or a man in science. She has held many senior leadership, he or she, has led many leadership positions at Trinity College, including, and I think I'll have to give it away soon, a director of research and head of the School of Nursing and Midwifery, and the first woman who was a nurse to be elected as the Dean of Faculty of Health Sciences in TCD, with responsibility for the schools of medicine, dentistry, pharmacy, and nursing and midwifery. She's been a senior executive management team at the university for the last number of years. Mentors often say a PhD thesis should never be your life's work. However, in the case of this individual, it has become a life's work. The groundbreaking work on day-to-day care for persons with Down syndrome and dementia launched a career, but she's never a solitary researcher. She became the director of research at the School of Nursing at TCD, and while building her own research program. It was at this stage she began the journey of mentoring other faculty, PhD students and postdocs. She became in demand from other universities, nationally and internationally, as a thesis committee member and research collaborator. The ageing of people with ID has been an under-researched area with negative consequences for both individual health and longevity, with the average age of death remaining at 63 in most countries. Unprepared systems and services impact health, well-being, and the quality of life for persons with intellectual disability and their families. This individual saw the need for an evidence base to drive improvements in care for people with intellectual disability as they age. As a result, they became the founder and principal investigator of the first ever longitudinal comparative study on ageing in persons with intellectual disability, known as IDS-tilde, and this is a supplement to the Irish longitudinal study on ageing. Now spanning 20 years, it provides a nationally representative sample, significant involvement of people with intellectual disability, alongside opportunities for comparisons with the general population. Indeed, IDS-tilde increases understanding of how lives and chronic conditions change over time in this cohort. This individual has been instrumental in advancing community integration for people with intellectual disability and has been called upon to evaluate quality of life and cost outcomes associated with movement from congregated settings. Her award-winning approaches on environmental design and technological innovations are absolutely improving the quality of life for persons with intellectual disability. She is a regular advisor on ageing and policy initiatives to government agency, community service organisations and patient advocacy groups at both national and international level. She has been successful in obtaining more than 10 million euros in research funding as principal investigator or collaborator. She has held grants from a variety of funding agencies, including the Department of Health, the Research Board, National Disability Authority, the All-Ireland Institute of Hospice and Palliative Care, Atlantic Philanthropies, and Horizon 2020. Throughout her career, she has sought to embed ID research across curricula and position students and colleagues for success. From being a PhD student onward, she has been a funded and significant researcher, but has never missed the opportunity to be a great educator and mentor. Students frequently describe her classes as the best they have ever attended, and at any one time there are a dozen PhD students, postdocs, and assistant professors relying on her advice and support, which she gives so freely and so effectively. She is unfailingly tenacious. Of course, you or we can do it is a dictum she sincerely follows. She has high aspirations, and while those aspirations may seem far away or even unattainable at times, she will strive to believe in them and to follow them. Henry Ford said that enthusiasm is at the bottom of all progress, and this is true of this individual. Selfless in the way they share their passion for people with intellectual disabilities and for carers and families who support them. They encourage people throughout the services in Ireland to strive to promote improved practices and better quality of life for persons with intellectual disability. They have highlighted the needs of a vulnerable ageing population at local and national level, as well as on the world stage. Her passion for this work and her research is remarkable, and she never gets tired. And I've travelled with her, and she never gets tired. So I am therefore very proud to be her colleague and delighted to be her nominator for the HRB Impact Award, which celebrates the unique contribution of her research vision. So I'll give it back to you.
Well, I fear the cat is nearly well and truly out of the bag. But we'll keep the fake suspense going for a little bit longer for a very important reason. I suppose I'd like to remind people that possibly something that people didn't know was that this award is inspired by the memory of the late Dr. Dermot Walsh, who, when I arrived in the HRB only 5 or 6 months ago, his name resonated almost immediately. It was the name I was hearing around the corridors. He was a close friend and colleague to staff in the Health Research Board. He worked as a consultant psychiatrist, a clinical director, a researcher, an advisor to the Department of Health, and an inspector of mental hospitals. And he was a leading researcher in mental health and responsible for setting up the National Psychiatric Inpatient Monitoring or Reporting System, which I mentioned earlier on, one of those databases that the HRB still runs and manages, and that is a major influence on policymakers and health strategy. Dr. Walsh was especially involved as well in moving Ireland in the context of Sláinte care from a system of old asylums and inpatient-only care to care for people with mental health difficulties based in the community and founded in the community. And the work he did and the change that he influenced is really a perfect example of everything that the HRB Impact Award is about. So it's entirely fitting and we're really delighted that we have Dr. Walsh's wife, Eilish, here this evening, who's going to present the award. And I'm going to ask Eilish Walsh to come to the podium just to say a few words before that, and then we'll get to the award giving. So Eilish.
I only have very few words. I'm just so proud to be here on the eve of Dermot's 2nd anniversary. And I'm not sure what he would say if he were here. And in talking to Tanya a little while ago, who's doing a postdoc in the HRB, she said, I said exactly to a T what Yvonne said in the office, which is that he'd say far too much fuss. However, I do feel that he might well be a little touched and maybe proud, particularly that the award is called Impact, because I think that's what he wanted to do all his life, was to make some difference to the services that he worked with. And he worked with many over many years, as well as with the HRB. I knew him for most of the years that he worked with the HRB, something over 50 years, I think. I'm not counting. Somebody else may do that better. And during that time, of course, I heard a lot about his work. I didn't always listen attentively to that. But I do remember when he talked about the people he worked with. And the impression I picked up was of friendships that started and were sustained throughout his working life in the HRB. And not only that there was work, but that there was enjoyment, and often there was fun. And I could begin to say many of those names over those 50 years, but I think I will be here for a while, but also I probably leave some important people out. But the thing that I do want to say this evening is that the last people, perhaps the section that he worked with most recently, just before he died, was with 3 people who have been extraordinary in the succour that they have provided over the past 2 years. And that's Yvonne, Antoinette and Deirdre. And I'd just like to say thank you to them. I look forward to meeting the winner this evening, and I think I've guessed it's a she, and I hope that they will have as much fulfilment, enjoyment, and indeed fun in their working career from now on as well.
So there's a bit of choreography here now, so I'm going to ask Alish to stay close at hand. I think there's an award to be dispensed, and without any further ado, and in case you haven't already guessed, I'm genuinely delighted to announce that the winner of the HRB Impact Award 2019 is Professor Mary McCarron, the Dean of the Faculty of Health Science, Professor of Ageing and Intellectual Disability at Trinity College Dublin. Come on up here. We'll make it easier for the photographer to get on stage.
Turn it so you can read it. I'm so proud to do this. Thank you so much.
Fantastic. So I think Mary is going to say a few words. I'll pop into a picture.
Thank you very much.
Fantastic. Can I have it?
Yes, that's lovely. Thank you. I don't know what to say, really. I firstly want to say how overwhelmed and absolutely grateful I am for this award, and particularly that to meet with Eilish and to accept this award really on behalf of Dermot, who spent all of his career really trying to better the lives of people with mental illness or who are in mental distress. And I suppose most of my career has always been to try and improve the lives of others in our community, other populations who are marginalised, and particularly those with an intellectual disability. So it really is a huge honour for me to accept this award. I want to say to Anne-Marie Brady, and thank you very much, Anne-Marie, for those very kind words, and I'm not sure if I recognised even the person you were talking about, but people who do know me will, part of my mantra has always been, that rules are for the obedience of fools and the guidance of wise men. And that's probably why I am what I got doing what I have done today. But when I started out on this journey, I worked as a nurse and I worked within disability services. And I realised very early on that things were not as they should be, and that we should look for a different life and have different aspirations for this population. But I also knew that I really didn't know exactly how I might do that, but I thought something needed to be done. And I thought, well, the most important group of people that I need to get around me here to help me on this road is people with an intellectual disability themselves. So I worked very closely with this population from the get-go, from the very beginning. And when I was in nursing, I had climbed what we would call the ranks in nursing very quick, and I was one of those with the hard hat. You know, when ward sisters were ward sisters? And when I had my second child, I decided that I wanted to go job sharing, staff nurse on night duty. And people thought, how could that happen, that you could do that? And I thought, oh yes, that's what I want to do. And I'm saying that because I know it's a struggle for many women, particularly who feel that if they take time sideways, perhaps, and struggle with careers and family, and just to say to people, I've done it, and it was really worthwhile and really good. And if that's what you want to do, you absolutely should do it. I think that's really important. But I work very closely with people with intellectual disability, and if I owe this award to anyone, it's to this population. It's to people with an intellectual disability themselves, because they were just a tour de force in creating that will and enthusiasm for me to do what I needed to do. I really want to thank all of the families, all of the carers, all of the services, the Department of Health, the HSE, and all of those many people that I had worked with throughout the years. My international colleagues, and many of them, were fantastic support. But I particularly want to welcome Professor Philip McCallion from the US, who really was such a support. Unfortunately, is not able to be here this evening, but who was a fantastic support always. I want to particularly acknowledge my own research team at Trinity, the Trinity Centre for Ageing and Intellectual Disability, the IDS Tilda team, and all of my colleagues within the School of Nursing and Midwifery, and indeed the Faculty of Health Sciences, where I've been faculty dean now for far too long, 8 years. So watch this space when I move out. I also particularly want to thank my family, and I know Eilish did mention this herself about, her Dermot and his talking about his work. And I want to thank Noel, my husband, who's here, and my daughter Louise, for listening to me for the last far too many years now, as I had another plan and another scheme up my arm to try to do something with. And Cathal, my son, isn't able to be here. And I want to particularly acknowledge and to thank my own family, my sisters and my brother. And I particularly want to acknowledge the inspiration that my mother has been to me, and indeed my father, who's deceased, but my mother is currently very unwell at this moment, and I particularly want to acknowledge her tonight, and just really glad that she is comfortable and peaceful. But I owe it so much to her, because mother was always a glass 3/4 full. She always had a plan, she always had something to look forward to, and she had just such a passion. And long before things like negative energy came into vogue, mother always talked about, oh, don't be listening to that chat, it's bad for your health, Mary. And she only talked about things that were positive, and that was absolutely fantastic. But most critically, I really want to thank the Health Research Board. When I went job sharing as a staff nurse on night duty, I was contacted by one of the consultants, Professor Michael Gill and Brian Lawler, to say that they had a job coming up and that this job would suit me wonderful, part-time job sharing, everything that I would need as a research assistant in Trinity. And I went in and did the interview, and they offered me the job, and I thought, I'm a total fraud. I don't know, I haven't a computer skill, SPSS is a foreign language, all of these things. And I can remember them saying at the time, you have a skill that we need, and that is your ability to communicate with people with disability, your ability to enter their world, to understand what it is that they need. And I started my journey with them. And I want to thank both Michael and Brian for that mentorship and support over many years as well. And I worked on what was called the genetic risk factors for Alzheimer's disease in people with Down syndrome. And for people who don't know, they are the world's largest genetically predisposed population to develop dementia, with a mean age of about 51 years. And given that my background, of course, was from a caring profession, I thought that's fine, and we know that this is the risk, but what are we doing about it? And I still say we have a lot to do. So I thought, what does that mean for care? How are they going to be supported? How are we going to skill up people in order to fill that gap? And I applied at that time to the Health Research Board, where they were offering the first clinical fellowships to nurses and midwives, and I was successful in getting one of them. And it was that training fellowship awarded to me from the HRB that really, I suppose, laid the foundation for me in my understanding of science and how to conduct good evidence-based work. But at that time, you know, I was not really impact factors and metrics. They didn't enter my vocabulary. And are they really and were they really important, and how important they still are? In my head, I wanted to change how we thought about care, the care that the people required. I felt I was very privileged to have worked with great scientists. I really understood the neuropathology of dementia. I knew what happened in somebody's brain when it was damaged due to dementia. And I always had a thought in my head, if I lost my leg in the morning, somebody would surely give me a prosthetic device of some description. And I set out on a journey to decide, I wonder, could I design dementia homes that would act like a prosthetic device that for those parts of the brain that were no longer functioning. And I worked with great engineers, architects, physios, and a wide range of professionals. And I designed, because my work in the HRB had led me to understand that the needs of people at mid-stage dementia, at early dementia, and at end-stage dementia were quite different. And the environments needed to be different, and the care approaches needed to be different. And so with that knowledge and evidence, I worked in the design. And I can remember when I was designing those homes, so many people, the CEO actually getting quite nervous at different times and thinking, are you sure this is right? And wondering, should we change direction? And I was told, HICWA won't pass that. You'll never get past HICWA with a kitchen like that, Mary. You know, it has to be this way. And this was the mantra, and this is years ago. And I thought every time I got a bit of negativity that something wouldn't meet this or regulations, I was writing the next paragraph of the book, defending why it was really important. I wanted environments that were empowering. I wanted home environments that looked like home from home. I wanted environments that created meaningful opportunities for communication, that were failure-free. And these were the concepts that I had in my head, and we managed to do that. And I see Evelyn, who's here, one of the clinical nurse specialists from the Daughters, and both of those homes now have won Best New Design of the Year and Best New Service of the Year. And that has been a pure treat because, you know, the people that are living there, you know, it is really a beautiful environment. And I am so pleased now. I can remember Brian Lawler and a group from GBHI coming and said, Mary, who did you design these for? I'm not trained as an architect, but I understood the science of dementia. And I worked with people to help them to translate that into what I wanted them to do. And I thought, who are you designing this for? And I thought, well, perhaps, Brian, the end user. And it could be me or you. And I think if we keep the end user in mind, you know what, we'll never go wrong in terms of what we do. So I really do want to thank, and it was with that initial award from the HRB, so that's what really was key to that. And then, of course, when Ireland launched the Tilda study run by Professor Kenny, I was on a mission. I thought, how come? We know that mortality is way lower for people, way higher for people with intellectual disability, and they're dying much younger than the general population. We know that their health is really much poorer. How come every country in the world that has ran a longitudinal study, none of them ever included people with an intellectual disability? And I thought, well, that's not going to happen in Ireland. I had no money. But I had willing people. I had people with an intellectual disability who told me that we could do it, we would make it happen. And I can remember having the first meeting of the scientific committee, bringing people together to help me with this. And they paid their own flights and their own train fares. and we had tea and custard cream biscuits, and I was told they're the austerity biscuit, Mary, but that's what we had, and that was the way it was. But there again, the Health Research Board stepped in, and I applied for funding, and I was awarded my first grant, and then I worked with the Department of Health to get further funding. And the Health Research Board have been so generous and so helpful, and I've continued to get that study mounted and off the ground, and to sustain it now for longer than I care to remember, because I'm giving away my age at this stage, but for 10 years, and another study for over 20 years with this population. So I'm really pleased about that. But when we began to think about this study, people said to me, "Are you crazy, Mary? People with an intellectual disability won't be able to partake. It'll be too difficult. The protocol it'll be much too complex. The questions mightn't be that relevant. You'll never get ethical approval." 10 years on, we have had a 95% retention rate. And that didn't happen by accident. That happened because people with intellectual disability were involved with us from the very beginning. They designed and co-designed how we would make this accessible to them. We held focus groups to ensure, well, are the questions that we are asking here, are they what you want us to answer? It's a comparison to TILDA, so we needed to hold comparability in certain components. There was other components like wealth and children that were not in the lives of this current population of people with intellectual disabilities. But there was other things that were really important to them. And they said to us, don't be so sensitive about some of these issues. We want you to include questions around relationships, around marriage, around income, around work, around retirement, around loneliness, around chronic health. These are not too sensitive for us. We want actually to be given the opportunity to talk about those, and they're all in there. And I owe an immense gratitude to people with intellectual disability for their advice, etc. And when we started off this without the money, I can remember, this was before the advent of GDPR and everything that went with it, sending out, I thought, how are we going to get support to get this study off the ground? And myself and Janet Swinburne, who was working with me at the time, we developed a scheme. So we sent out a call to people with intellectual disability randomly to every service in the country, all over the place. And we asked people to submit pictures of what ageing meant to them, and to submit a small narrative and a consent form that we could use them. And within 2 weeks, we got 250 pictures with narratives sent back from people with intellectual disability from all around the country. And we used that to create a photographic expedition, and we headed off to every festival, the Fringe Festival, the Ploughing Championships, everything and every event that was on, to actually make visible this population who were hid, who were not visible, who had not been included in previous longitudinal studies. But what also made this study very possible in this country, and I know Darren has mentioned this, at the Health Research Board we have what's called the National Intellectual Disability Database. And this was just such an important resource because it made the science behind this study so strong. We were able to randomly select 10% of the total intellectual disability population using that database. And this has been absolutely, really, really critical. And I want to thank my colleagues again in the Health Research Board because no other country in the world does this. So this provided us with huge infrastructure. And you know, we found out a lot of issues that were happening for people with intellectual disability. And we have had numerous bolt-on projects as a result of this. So this is not doing research for research's sake. This is about doing research and then looking at the problems and saying, okay, what can we do about them? We found out that almost 90% of this population were totally physically inactive. They weren't doing physical exercise. So Eilish and Mary Ann and others working with Age and Opportunity and University in Barcelona, we applied for an EIT health kick, and we now have developed a whole programme across countries in building physical activity leaders. This is empowering people with an intellectual disability to be physical activity leaders within their own communities and their own counties within the country and in different countries. And this is truly fantastic. We've developed really good resources and tools for families to assist them with advanced planning, to assist them with future planning, working with the like of the Irish Hospice Foundation and the National Institute of Hospice and Palliative Care in developing planning tools to support decision-making of end of life. So it is all about identifying the problem and moving forward. We also understood that, there's a huge dearth of knowledge amongst the general community, and particularly as this population now are going to be accessing mainstream generic healthcare services. Really a lack of knowledge amongst many healthcare professionals on how to support this population, how to perhaps do a comprehensive health assessment, how to communicate. There's huge communication barriers. I've done a lot of work with the UK in terms of looking at that whole work around death by indifference and the whole problems that there's been for people with intellectual disability accessing mainstream hospitals in the UK. And we decided that this isn't about the blame game, blaming other healthcare professionals. It is about identifying a problem and getting out and doing something about it. So Ailish here developed an online MOOC and an accessible health assessment, and we have had thousands of people from all over the world who have now accessed that MOOC and who have really, as a result, would have said that it would have changed the practice, as well as developing interdisciplinary masters in this area. So this has been huge. It is really about the translation. People at the beginning felt, the only question I have now from people with an intellectual disability is from the people who are not included in the study and wondering why they're not going to be asked questions. And this is the other issue. But so many of them, we use every opportunity to bring our participants to have events that they can come to Trinity. And this is just a major source of enjoyment for them, and it's been really important. So I suppose long before things like PPI and public patient engagement was ever spoken about, it was something that we just lived. And I really want to acknowledge, I suppose, the sterling work of the HRB in really pushing public patient engagement agenda and building that human infrastructure and the skills and expertise throughout the country through the PPI Ignite programme and other such awards. I think this really will shape how we conceptualise and think about problems and what we're doing. But I wanted to leave a legacy behind me, and I wanted to ensure that this wasn't about Mary McCarron. And I have seen very good, programmes, and then somebody, who's a key to that programme goes and the whole thing falls. So all my career was about building future leaders, so that if Mary McCarron isn't there in the morning, that this can all continue. Building leaders with passion, building leaders who want to go out and try to fix things. And I'm really delighted that we have probably 15 PhD students graduated of IDS Tilde over the last number of years from every discipline: medicine, psychology, nursing, sociology, the physio, dentistry, pharmacy, and these are all leading the various arms. So I have no doubt this will be sustained. And I'm really, really pleased about that. So creating that human infrastructure to me was really important. Then setting up the like of the centre at Trinity was really important as well. But there is one further arm of the journey that there's a lot of work to be done, as well as continuing now at IDS Tilde. As I mentioned earlier on, my initial work started looking at the issue around dementia in people with Down syndrome. And while we have made some progress in some parts of the country, services are patchy, they're poorly developed, poorly resourced. And if I got €1 for every phone call I have from a family or from a GP throughout the country to see could I assess somebody, I could fund IDS Tilde on its own right. Because they just cannot access services. The mean age is 51. Most of them not entitled to access mainstream generic services until they're 65. We're using chronological age for a population that has absolutely no meaning. So I can remember this elderly mother, coming with her son, who was in his 50s with late-stage dementia, to see Professor McCarron. And I met her with Brian Lawler at St. Pat's down at Houston Station. And I met this woman, and when I met her and I met her son, they were both frail and they were both totally distressed. And I made a vow to myself on that day that this is morally and ethically wrong. How could a country so rich as Ireland be so poorly equipped to support this population? And I wondered, how did they ever get from Euston Station, the train, to St. Pat's? And I walked them back and I listened to their story. And I came back and I headed straight for the department. And I wrote another letter, and I thought, I knew that the National Dementia Strategy was being developed at the time, and I thought, if I do nothing else, I'm getting them mentioned within this strategy. Because if people aren't within the strategy, when the train has left the station, it's too late. And I got people with intellectual disabilities specifically mentioned within the strategy. And my wish was that we would have a national dementia centre, a centre of excellence for people with intellectual disability in this country, with satellite centres throughout the country to assist with both diagnostics and care, building on the model that I did at the Daughters of Charity. And the next leg of my journey is going to be now, I've got the funding from the government to set up this national centre of excellence with satellite centres throughout the country. I was really interested, of course, in the whole design thinking principle this afternoon, because I have no clue how this is going to happen or how it will work, but I know that it will happen. And I'm also really, really pleased that we have had no prevention trials in this population. We have had no studies of that nature, yet this is the world's largest genetically predisposed population to develop dementia. So I'm particularly pleased that another one of my PhD graduates, Emer, who's also here tonight, is now an Atlantic Fellow at the wonderful Global Brain Health Institute at Trinity. And she's going to carry the mantle and push the agenda around treatments and preventions and trials in this population. And I will have set up the physical infrastructure to the National Memory Clinic and its satellite services to enable something meaningful like this to happen. So that really, I suppose, is the final piece that I really want to of the programme for the moment. And I hope you understand my passion for impact. And often young researchers say to me, how have you done this? And what advice can you give somebody? And the advice I generally give is that you absolutely have to be passionate about your area. You need to have passion to make an impact. I wasn't passionate about H indexes and impact factors. I was passionate that this was going to change the lives of people with an intellectual disability and their families. But you also have to have some grit, and you have to have stickability. And I am a marathon runner, and now that my knees are shot, I'm a long-distance cyclist. But yes, you do need grit and you do need stickability, because there will be bumps in the road and there will be times that you'll be despondent with negativity. People who know me know I don't deal with negative people. I don't surround myself with them because they drain me. So I'm very lucky to have surrounded myself with people who are just full of positivity. And I think that has been absolutely key. But you will need that grit and you will need that stickability when things are going bad to get you over the hard time. And you need to continue to have the passion for impact, because there's people out there dependent on us to make that impact. Thank you.
So I don't know about you, but for me that's incredibly inspiring. I think I would run out of adjectives if I tried to summarise what we've just heard. So thank you very much, Mary. For me, I suppose, we didn't design this, but if you were to kind of get a descriptor or an exemplar of design thinking at work, I think we've probably heard it. So lesson learned. But look, I'm going to leave it at that, except we're still in This Is Your Life mode. There has been a short video that's been prepared by your team, Mary, which you're going to show now. And before it comes on, I'm going to say, look, after the video we'll go straight to dinner, so I'm not going to get back up on stage. But roll it, Colette, there, wherever you are.
Every step you take, I'll be watching you. Every single day, every word you say, every game you play, every night you stay, I'll be watching you. Oh, can you see you belong to me? How my poor heart aches with every step you take, every move you make, every bow you break, every smile you fake, every claim you stake, I've been watching you. Since you've gone, I've been lost without a trace. I dream at night, I could only see your face. I look around, but it's you I can't replace. I feel so cold and I long for your embrace. I keep crying, baby, baby, please. Oh, can't you see you belong to me? How my poor heart aches with every step you take, every move you make, every bow you break, every smile you fake, every claim you stake, I've been watching you. Every smile you fake, every claim you stake, I've been watching you. Every smile you fake.